Hi, my name is Lianne E. This is my Session 5 final presentation. So week 1, dangerous but common medical errors. Medical errors represent a serious public health problem and pose a threat to patient safety. All patients are potentially vulnerable, therefore medical errors are costly from a human, economic, and social viewpoint. Common medical errors include transcription errors, wrong site surgery, medication errors, look-alike, sound-alike words, and documentation errors. So transcription errors can occur as a result of outsourcing or offshoring, where a doctor will send a recording of his post-op or consultation notes for transcription. In 2012, a diabetic was actually killed as a result of a transcription error of this nature. And then to the right, here's some examples of transcription errors. In the first, you can see that the word age has been changed to AIDS. In the second, a dosage has been changed from 40 to 400. In the third, there was a complete admission of the word no. And in the fourth, the medication interval, BID twice a day, was changed to TID, which is 3 times a day. And over here, we have a quote showing a statistic from the Joint Commission from 2015 about the percentage of transcription errors. And they did discuss in this article that doctors as editors actually did not improve the error rate. It either remained the same or actually increased. Wrong site surgery. Wrong site surgery is one of the 4th commonest sentinels after patient suicide. It occurs when a doctor or a surgeon makes an incision on the wrong body part, does the wrong surgery, or amputates the wrong body part. The World Health Organization has launched a safety challenge that is a 3-step process. Sign in, a patient's chart, surgery, documentation, EMR, everything is reviewed prior to the patient being anesthetized. Timeout is before the incision is made, and sign out occurs after the incision is closed and before the patient is removed from the OR. Standardizations of this nature, especially those in the last 20 years, have been spearheading the advances in our healthcare system here in the US. Medication errors, overprescribing, look-alike, sound-alike drug names, and the prescription of an allergen are the 3 most common medication errors that you see in medicine today. So overprescribing can be too many types of the same classification of medication being prescribed. Benzodiazepines such as Xanax, Klonopin, clonazepam, and alprazolam are good examples of that. Look-alike, sound-alike drug names, things such as Benadryl or Benazepril are commonly mistakes that are made. So Benadryl is a oral medication for skin irritation such as bug bites, poison oak, or a skin irritation from an allergic reaction, whereas Benazepril is a high blood pressure medication. And then prescription of an allergen. It's easy enough for a doctor to overlook an allergen list or an allergen list that is not complete and prescribe an allergen unknowingly, certainly not intentionally. And then this link right here is a list to the confused drug names list that has been compiled of all active medications in the US right now. Look-alike, sound-alike words are a big one. Here are a ton of examples. Some of these are actually structures that you can confuse. Others are locations on the body, and then some of them are actually diagnosis names. So, for example, the difference between dysphagia and dysphagia are very, very different, or even the words viral versus virile. Documentation errors can include incorrect EMR input, errors from transcription, outdated records, or incomplete records. So it can be as simple as incorrectly entering a patient's insurance ID, which I've actually had happen. It creates a lot of billing issues and a lot of wasted time on behalf of the medical assistant dealing with it. It can be errors in transcription, which you've already talked about in detail, outdated records. So, the patient could have new allergies and new medications that haven't been added, or incomplete records where things have been omitted or left out entirely. So this is my favorite quote that kind of helped me sum up week 2's personal reflection assignment. I didn't learn anything new about myself, but I know that I am an INFJ, and that these 2 quotes, which I think are really the cores of my personality, come from the Defender subtype. I learned a lot as a medical assistant, things that I think will be incredibly beneficial to me being a hospital administrator. And then my codependent nature, that really plays into both good and bad things. But I did learn that one of my weaknesses is confrontation, and that will be something I have to work on as a hurdle and overcome to be an effective and productive hospital administrator. Week three's medical scenarios, again, I didn't really learn anything about myself that wasn't already incredibly well known to me. But essentially, I don't believe it's ever okay to lie about a mistake made in the medical field. Sure, maybe nothing comes of it the first time, but that first lie will make it easier to lie again. And the next time you lie, somebody might actually get hurt or even killed from your example or from your omission. So I think it's important to stick to this Bible verse from Psalm 34, verse 13. So, interview with a physician week 4, I interviewed my father-in-law, and this quote right here is, I think, the core of how those who work in medicine need to view their relationship with the people they work with, especially the patients. And here are just some things that we covered during the interview: common medical errors, how to make yourself an asset, the importance of building a good patient-doctor relationship, and how a higher education for the general population has been one of the greatest hurdles lately for that relationship building. And then the idea behind do no harm, and the fact that it doesn't actually come from the Hippocratic Oath, and that it means more that your benefits need to outweigh the risks when it comes to patient treatment of any kind of condition or surgery or anything of that nature. Week 5, how do I make myself an asset? I think it's important to remember that there is no I in team. Everybody in the medical profession has a role to play, and they're all important. Operating under biblical imperatives and engaging in continuing education and reading and staying involved are the two most important ways to stay knowledge proficient. My father in law serves on a peer medical review board at the hospital where he was chief of staff, and he has found that to be one of the most beneficial things for his role. So I would look for things of that nature as a hospital administrator. And then lastly, here are just some of my favorite Bible verses that I really feel speak to how we should interact with our coworkers, especially in medicine, and how we should approach patient care. Thank you.